Welcome to Parenting Unscripted, everyone. I am your host, Katie Collett. We're going to have a great conversation today with our guest. This is Dr. Elizabeth Dixon of Sentara Health. She is a licensed professional counselor. Dr. Dixon, thank you for joining us today.
You're welcome.
So the big thing that we are going to be chatting about today is pre- and postnatal mental health. But before we dive fully in, I want everyone to get a feel for you and for your life. I know that you're a mom, so tell me a little bit about your family.
Sure. So I am a mom of 4. We have a daughter and then 3 sons. Our oldest is 14 and then 11, 9, and 2.5.
Oh, wow. All right. So you have your hands full. What was it like for you to go from 1 to 2 to 3 to 4? How did you make all of that work?
Yep. So I would say the hardest transition actually is 0 to 1 because your world is so rocked.
Yeah.
You go from no responsibility to all the responsibility. And then I would say with each additional child, it got a little bit easier.
I think that's great. And what do you feel like made it easier about each additional child? Just because you already had the experience or because the kids had a playmate?
I wish it was the playmate piece, but no, I think it's the experience piece. You feel a little bit more confident in your ability as a mom with each kid you have.
Yeah, that makes sense. I mean, I say that makes sense as I am a one and doneer, so I have absolutely nothing to compare that to. But I feel like I've seen that with a lot of my friends of multiples as well. So you really do feel more confident. Mm-hmm. You know, there are times that I've said to my husband, you know, if we had a second, I feel like we could have really knocked this out of the park. But you know, one and done it is, and that's super great. What made you decide that you wanted to become a professional counselor?
So I knew from very early on, I wanted to do something in the mental health field. And so my bachelor's degree is actually in psychology. And I thought that I would end up doing like profiling or working for the behavioral health unit at Quantico. Mm-hmm. And so my undergraduate internship was in investigations. And then after getting my bachelor's, I decided to take some time off of school. And in that time off, I got married and we started a family. And so I actually didn't go back for my master's until 2016. And I did some exploration as to if I wanted to get the master's in clinical psych or if I wanted to go the counseling route. And I ended up going counseling because clinical psych is more assessment based. Mm-hmm. And while I do love the assessment piece, I also like to see the patient journey across from the intake until the end of my evaluation of them. Yeah. And, you know, I've also done private practice. And so just sitting with them throughout their journey, I like that part. And so that's why I went with counseling over clinical psych.
I think that is so special to be able to follow someone through their whole journey there. Mm-hmm. I know for myself as a journalist, when I became a mom, I feel like I got even better at my job. There was just something about it in me that opened me up when I was telling stories. Do you find that becoming a mom helped you in any way when it came to your career?
Absolutely. It has widened my ability to be empathetic with more patients because you can connect with different feelings. Mm-hmm. And it's especially increased my ability to be connecting with other moms, which we see at Sentara, either moms that are newly postpartum or currently pregnant, or moms that, you know, have kids that are grown. It doesn't matter. But yes, it's absolutely increased my ability to become a better counselor.
I think that would just be invaluable. So let's get into the pre- and postnatal mental health. We'll talk about prenatal first. Mm-hmm. You know, there's so much that happens to us during pregnancy. I reflect on when I was pregnant and I would be laughing and so happy. And then the next minute I was crying and I couldn't figure out why. Mm-hmm. And I thought I was absolutely losing my mind. But I quickly learned I was not. That happens to a lot of people.
Yes.
What is it about our bodies at that time that is causing us to have all of these emotions?
Our bodies go through so many changes. And so there are the physical changes, right? The weight gain,
yes,
the change in body image, the way your sleep is affected. And then there's the hormonal changes where you get the estrogen and the progesterone surges, and that can cause mood swings and irritability. And then, like you said, sometimes you're crying, sometimes you're laughing. We have identity changes because you go from being just who you are as a person to shifting into being a mother. Mm-hmm. And so you go through so many changes in that 9 months and then beyond. And so it's really like a roller coaster.
Yeah, it's a big roller coaster. What are some of the techniques that you will talk to people about when it comes to dealing with these big changes and feelings of emotions?
I think the very most important thing is everybody's experience is different, and that it doesn't matter what your experience is or what you're feeling, whatever that is, it's valid. And it's okay to feel that way. I think so often mothers are expected to just feel joy. And for many, I would even say most, it's not all joy, and that's okay.
Yeah, listen, I have people, clutch their pearls when I say this. I didn't like being pregnant. I was sick morning, noon, and night. I didn't feel well the whole entire time. Really, the only thing I liked about it was feeling my baby move. I thought that was such a special little secret between the two of us. But other than that, I didn't love it. And I have people who will get very upset with me when I admit that, even to this day, almost 12 years later. And, I think people see on social media that things look beautiful and perfect. And pregnancy's hard.
It is.
Yeah, I think that people need to kind of understand that not everyone does love it. It's worth it, but not everybody does love that. How do you help moms understand, fully grasp, when you say, hey, it's different for everybody, what are some things that you will say to them to, help them realize, when you say what you're feeling is valid, how do you make them fully understand that? What are some things that you'll do together?
So in certain instances, that's when self-disclosure has really worked now that I'm a mom, to say, I also cried. I also wasn't overjoyed all the time. Feelings can coexist. You can be joyful and terrified at the same time. And so I think just connecting with what they're feeling, using validation, asking meaningful questions, reflecting back what they're feeling when they express that, and making sure that you're not judgmental in any way, because there are sometimes, everybody's experience is different. And so there are times that I've been shocked by what people experience. But again, just because it's different than my experience doesn't make it more or less than.
Right. Absolutely. When we come back on the other side of the break, we're going to talk about the one thing, and I know there are probably many, but if there's one big thing that you wish women and their partners would know when it comes to mental health during pregnancy, maybe even something that you would want them to ask. So we will chat about that in just a moment. But in the meantime, everyone, you are watching Parenting Unscripted, and we will be right back. Welcome back to Parenting Unscripted. I am your host, Katie Collett, and joining me once again is Dr. Elizabeth Dixon of Sentara Health. She is a licensed professional counselor, and we are laser focused today on pre- and postnatal mental health. So let's jump right back into where we left off. Is there anything that you really wish that women would know about their mental health as they begin their pregnancy journey? Or anything that you wish they would ask you?
I think that the most important thing that women should know when they're pregnant and working on mental health or experiencing any sort of mental health issues is that it's okay to ask for help. And that help can look a lot of different ways. It might mean partner support. It might mean seeing a counselor, but it's okay to ask for help.
And let's talk about partner support. What does that look like? What should partners know?
I think the most important thing a partner should know is that above all else, she just needs your unconditional support. And women already bear a pretty heavy mental load. And so if you can just step in and pick something up off of her plate, that's the best case scenario. If she's having to say, hey, can you wash bottles? Or, hey, can you change a diaper? Or, hey, can you get up with the baby at 1 a.m.? You're just adding to the mental load. And if you can simply be proactive and take something off her plate, that's the best case scenario. But if you're not sure what to do as the partner, ask, because asking and helping in some fashion is better than not helping.
Yeah, that's the big thing too. I mean, it is a team effort. This is, yes, we are creating the human as we sit still, but like we are a team, and this is your baby as well. So, you feel free to, jump in and do what feels right. Are there any signs that a spouse should look for when it comes to prenatal mental health, when, a spouse or a partner realizing, this might be a little deeper than, just the baby blues, as some would call it?
I think significant personality changes, a lot of crying, unable to get out of bed, significant sleep disturbances. And so that's where the stepping in and taking a shift is so important, so that mom can get 4 to 5 hours of uninterrupted sleep every night after the baby is born. Excessive crying, mood swings. I think those are the main ones.
And would you say that's both pre and postnatal?
Yes.
Yeah. Okay. Yeah. That makes sense. And it takes time. How long would you say does it take for our hormones and our emotions to go back to quote unquote normal?
I think this is another thing where there's no one path. And so for everybody, it looks different. I know for myself, after the first baby, it took me probably 9 months to feel normal again.
Yeah.
And then each time I bounced back a little bit quicker. But also, when women have more than one child, each postpartum journey is different. So maybe the first time you're depressed and the second time you're anxious, or maybe you have a really great first postpartum experience and then the next time you don't. And so I think just being self-aware, and then partners, families, friends also being aware of what's happening so that they can provide support if needed.
Have you found a difference when it comes to, I hate to say older moms, but I mean, I feel like I was an older mom. I was pregnant in my 30s versus younger moms, like late teens, early 20s, when it comes to needing help or different emotions or challenges?
I would say in private practice, I could tell a difference. And so I'll also say I had my first at 28 and my fourth at 40. And so I can tell you at 28, I still felt kind of like a child myself. Yeah. And so emotionally, I was a lot more labile, and I felt more emotionally grounded as I got older. And so in practice, I've also seen the same thing. So the support can look different because as an older mom, I needed support so I could work. And as a younger mom, I needed more emotional support. And so for sure, I think age may play a part.
When you have friends and family members who want to be involved, what are some of the best ways that they can help? First for prenatal, and then we'll talk postnatal. What are ways that they can step in to lighten the load?
So help clean the house, wash dishes, prepare meals. If there are other children, maybe take that child out so mom can rest. Just anything specific to that mom. So that's gonna vary too, but I would say for sure the meals, the cleaning, just little things you can do to make her day-to-day life easier.
And I found too, there are times where your friends will be like, would you like me to come over to help with this? Would you like me to come and do that? And you don't want to feel like a burden on your friends. So even though we want them, we may say no because we feel as though that we're the ones being the burden, but they do want to help. So do you talk to your clients or your patients about, accept help when it's offered?
Absolutely. Accept help. And I would say to the friend that wants to help, don't ask, just do it. So I had some really great friends. My second time I struggled with anxiety. And so I just didn't want anybody in the house. And I had a 2-year-old and a baby. And so I had a great group of friends that every couple of days somebody would drop food off on my front steps. And I would get a text that would say, there's lasagna on the front steps.
Oh my gosh.
Or, I had somebody DoorDash pizza the 4th time. And so I think that's nice because if someone's coming in the home, mom has to be prepared, right? And so newly postpartum, a lot of times you don't feel up to having people over.
Yeah. You don't feel great for a little while. It takes some time because you feel like you got hit by a Mack truck and then you're just trying to figure out how to shower and clean yourself without everything leaking. And it's a very humbling time. And, you do want help from people to come in, but I like what you said about what your friends did. Or, sometimes we don't want anyone to come in the house because we are trying to navigate our own bodies and changes. So they were sweet enough to just leave something on the porch and just do it and don't ask. That's fantastic. As long as we said, you're willing to accept people doing that. Is there any way that a mom can mentally prepare for the changes that she might feel or go through? Is there a way that you can kind of prep people ahead of time to say you may experience this or feel that?
Sure. If they're seeing a counselor, the counselor could prepare them about, the physical changes, the emotional changes, and so on and so forth. Certain moms will do research. There are prenatal classes. And I think that that's helpful. I did that the first time.
Yeah.
So yeah, I would definitely say you can prepare ahead of time, but I'll also say that nothing really prepares you until you have a baby.
And that is a fact, 100%. We are going to take a quick break, and then we will be right back with Dr. Dixon to talk more about pre- and postnatal mental health. Hope you're enjoying the conversation. Welcome back to Parenting Unscripted. We are continuing our conversation with Dr. Elizabeth Dixon of Sentara Health, a licensed professional counselor. Our main focus today is pre- and postnatal mental health. Let's get right into the delivery room, where there is so much going on. And when the baby is born, there are times where you see, many times, videos and pictures. Everyone is elated. They're excited. They're so happy. But there are other experiences that, because of social media, you don't always see it, where there's no connection to baby at that time. What would you say, and I don't even want to call a normal response, but is there a more concerning response? Or, is it just going to be different for everyone and they have to work through it?
I think it will be different for everyone and they have to work through it. But I also think there are certain responses that providers are watching for, and that would be complete disconnection from your baby. I don't think they see it often. And typically that would be a mother that had maybe experienced lack of appropriate parenting herself growing up.
Yeah.
But otherwise, yes, I would say there's a wide range of emotions, from joy to sadness to scared, overwhelmed, happy, and that any range of emotions is completely okay.
Yeah, that is key right there. Whatever you feel in that moment is okay, because your body has just been through so much. We touched a bit on postpartum depression, but I want to take a deeper dive into that, because, I have a number of friends who survived postpartum depression, but what a struggle and what a battle that was. What would you say are some of the key signs of postpartum depression, as opposed to a different type of, maybe just feeling down or overwhelmed?
So it would need to be persistent. Baby blues typically are a couple weeks and then you bounce back. So with postpartum depression, it's going to be persistent over a period of time, and the symptoms are going to be more significant. So baby blues may be a little tearful, not sleeping okay, but you would bounce back. With postpartum depression, it's going to be more severe symptoms, not sleeping or sleeping all the time and can't get out of bed, crying all the time. The other thing a lot of women experience that I think is not talked about is postpartum rage. That can be part of depression. Where you're just angry. Yep.
And like when you say you're just angry, just in general at all times, or like something that normally wouldn't trigger you does?
Yeah, I think it can be both. I think it will depend on the person, but easily triggered, I think, is a more general response.
Do you have, we were chatting in the break about resources. So let's dive into that for sure, because it's just so important for people to know where to go and at what point they should go somewhere.
So the very first place I would start is Postpartum Support Virginia. And so they have a website and they have a ton of resources based on region. So for counseling or for medication management or for support groups locally, Sentara has outpatient, they do PHP, and they also offer like lactation support, which was huge for me at Sentara Lee, and I believe at Sentara Princess Anne. They both have outpatient lactation support clinics. And so that was incredibly helpful for me. And then, of course, there are all sorts of practices across Hampton Roads that specialize in perinatal mood and anxiety disorders. A couple that I know of are Hilltop Counseling and Wellness, Coastal Virginia Counseling, Beach Counseling, and then Sentara Behavioral Healthcare Centers has providers that specialize in perinatal mood and anxiety disorders.
And for people to find these resources, is it really just a matter of going online and clicking around a little bit to do a little research there?
Sure. Our Postpartum Support Virginia will really help you. And they also have a special section for dads.
I was just going to ask you, get out of my head. So, a lot is going on for dads as well. So can we talk about that for a moment? And in that section of resources for dads, what might they find?
support groups, outpatient counseling, because while their hormones aren't changing like a woman's, their identity has changed the same as the mom's has changed. And the way life looks has also changed. And so some men need counseling, and that's fine. There are support groups, maybe marital counseling, so that they can adapt together to what their new roles look like.
Yeah. Can you, if you notice that your partner is struggling, whether it be, mom or dad, are you able to, on their behalf, get some of that research in there and set up any form of appointment for them? Or because they're an adult, they have to, do it themselves?
They would need to do it themselves. As a practitioner, I couldn't do it. Now, I will say, if you come into a Sentara ED, and we do see some moms that are postpartum that are like, something's not right, I need help. If they receive an evaluation, we can actually schedule that appointment for them if they're willing to let us do it.
Gotcha. When you say ED, what does that mean?
Emergency department.
Got it. Emergency department. Understand. The medical terminology I'm going to learn at some point. I think it's wonderful that all of those resources are out there and they are fairly easily accessible. Is there ever a situation where if someone's like, my spouse needs help right now? Is that something where you would almost need to go to the emergency room first?
Absolutely. I would say if it's an acute psychiatric issue, like that postpartum depression we were talking about, where you were concerned for their safety or the safety of the baby, you would absolutely want to go to the closest emergency department and have them evaluated.
Okay. Yeah, I think it's good for people to understand fully what all of the options are. On a less serious topic, whenever you are a new mom or, a mom of however many years, we have been moms for quite a while now, you tend to start forgetting certain things. You do certain things that might be different than what you would normally do. And of course, everyone calls that mom brain. Is mom brain a real thing, or is it really just a crutch? Please say it's real.
It is real.
Yes.
When you're pregnant, your neuroplasticity changes and the chemistry of your brain actually changes with each pregnancy. And we also retain each baby we carry's DNA. And so you make many changes and those stay with you even after you've had the baby.
So it's, if we are forgetting things or, doing things differently, it really is because of all of the changes in our bodies at that time, and that just stays with us. That makes me feel so much better about so many things. Is there anything that we didn't touch on today that you're like, gosh, I wish someone would always ask this when it comes to someone coming into your practice to ask you a question?
Not that I can think of, Katie. I think the most important thing to remember is, again, everybody's experience looks different, and it's okay to need help. A long time ago, they used to say it takes a village, and I think some of that has changed over the years. And I'm not really sure why it's changed, but I still think as moms, it takes a village, and that can look different for every person. And needing help does not make you a bad mom. It's okay to need help.
Yeah. And I think accepting the help and asking for it makes you an even better mom a lot of the times, because it just makes you better in general. Dr. Dixon, thank you so much for taking the time with us today. It was a great conversation, and I know our viewers are going to get a lot out of it. So thank you. And thank you, everyone, for joining us. Remember, Parenting Unscripted has new episodes every Tuesday at 9 o'clock. I hope you have a great day. Be good.